Well, hello, everybody. My name is Madix, and I did my practicum at the BC Centre for Palliative Care. I really do want to start with the territory acknowledgement, and I did put the website at the bottom there for anybody who maybe is unsure of where they lay. I want to acknowledge that this presentation was created on the traditional territory of the Lekwungen people, as well as the Songhees, Esquimalt, and Quesanich peoples, on whose land I'm able to work, study, and play. I wanted to start with who is the BC CPC. The BC CPC is an organization that works with provincial partners within the healthcare sector and within the community in order to promote best practices in palliative care. What is palliative care? For the purpose of this presentation and to align with what the BC CPC puts out, I use this definition in order to further understanding. It seeks to improve the quality of life of people with life-limiting or life-threatening illnesses, addressing pain and symptom management alongside social, psychological, and spiritual support. For my practicum, I was focused on ACP Day, which is Advanced Care Planning Day. It was April 16th. I did media tiles. I put 2 on the screen there just as an example for you. We ended up doing 8, I think, in total, and then doing a video at the end as well. That was very cool to do. Tasks that I did included focusing on communication to pharmacies, as well as vulnerable population agencies for future stakeholder lists. The media tiles that I have on the screen here. And then we had a public health initiative meeting every second Thursday as well that I was able to participate in. And I was able to facilitate one of those as well, which was a really good experience. So what is ACP Day? ACP Day is a campaign put on nationally and provincially to create awareness for advanced care planning. Advanced care planning can be done by anybody 19 years of age and older, and it's not just if you're really sick or if you're, a senior or anything like that. And this year's campaign really tried to focus on the idea of life's little incidents. So let's say you get into a car accident and you're incapacitated in some kind of way. You want to make sure that somebody is able to speak for you if you are unable to. Examples of this might be like you need to relearn how to speak, or you don't know the passwords to something in your house, or you lose your memory, anything like that, where you're going to need somebody to assist you. This planning is for that. It's not just for end-of-life care. The greatest thing I think about this year's ACP Day campaign was that the demographic and the reach was a little bit larger from my perception. So instead of it being, like I said, more focused on end-of-life care or serious illnesses, it was really focused on people who are still, skateboarding at 60, or going on a bike ride, or doing really everyday things that can end up in everyday incidents like that. The call to action as well was really great because it focused on really just taking the initiative to plan, which I think is kind of the largest hurdle. You talk about planning for those instances, and you talk about planning for the future, but actually doing it is kind of the hurdle. So with ACP Day, there is also a website, as well as on the Instagram, you are able to check it out, all the media tiles that I did and the video. It's the BC Centre for Palliative Care on Instagram. The call to action that I wanted to focus on is number 21. I wanted to focus on this because I found that there is a gap in service for end-of-life planning and advanced care planning. When we look at BC especially, pardon me, there is a plethora of beautiful cultures here, and there are not a lot of culturally appropriate, accessible programs for end-of-life or advanced care planning. The BC Centre for Palliative Care does a fantastic job of providing multiple languages, lots of accessibility, lots of toolkits, but I would call upon the federal government to provide sustainable funding for existing and new Aboriginal healing centers to address physical, mental, emotional, and spiritual harms caused by residential schools and ensure funding. So basically, I believe that the government should definitely look into these kinds of care, these kinds of access to provide culturally appropriate care for things like this versus just doing a Western settler point of view. The PHSP value that I wanted to talk about was considering that ACP impacts all community members and all walks of life, so just as public health does, and the importance of equity and equality within health initiatives is a major pillar for the Practicum, as well as for the BC CPC, and as well as the PHSP program as a whole. For the PHSP knowledge, I really wanted to talk about written and oral communication because we did everything on Teams. I had never used Teams before, and we used SharePoint, and we made a website and did all this crazy stuff on the internet, and it was really essential that we were able to continue our written and oral communication through our Teams meeting and also through consistent emails. It was really awesome working with Melody and Pam in the ACP Day meetings on Thursdays because everything was set up and we were all very transparent about little hiccups that we had with technology, but we made it through and our communication definitely helped that. My final thoughts. Gaps in service is kind of the biggest takeaway that I got from this. I work as a mental health worker now with vulnerable populations in Victoria. And while learning so much about the BC Centre for Palliative Care and what services they have, I realized that it's really not as accessible for vulnerable populations. And I wanted to continue to focus on bridging that gap. I also grew a lot in this time, and I wanted to say thank you so much to my practicum supervisors and instructors because life outside of school has been a little bit hectic this last couple of months, and everybody supported me so well, and I want to say thank you so much. I also do want to shout out Aislinn and Thorn as well because I would not have been able to complete this bachelor without you guys. And then, yeah, thank you to Melody Jobsey, Pam Workington, and Dr. Iman Hassan. Working with you was amazing and super, super empowering. Those are my references.